Good morning. My name is Dr. Sephalie Patel, and I'm one of the anesthesiologists at Moffitt Cancer Center. And today we're going to go over what to know about anesthesia. What I'd like to do this morning is go over the couple most common questions that my patients generally have, and then go over what to expect on the day of surgery. So the most common question that I get is anesthesia safe? Many of my patients are actually more scared of anesthesia than of surgery. And the short answer is yes, it's very, very safe. Anesthesia is really built on the foundation of safety. And through the use of surgical safety checklist, a systems-based approach, and teamwork, we really do get you safely through surgery. And if there were any questions in our mind of anesthesia not being safe for you, your anesthesiologist and surgeon would probably let you know that before surgery. The next most common question that I get is, who is taking care of me? On the day of surgery, you're going to meet a lot of people, and it's very easy to get confused about who's on your anesthesia team, who's on your surgical team, who's on your nursing team. The anesthesia team is usually comprised of 2 members, and we use something called the anesthesia care team model. This is probably the most common model in the United States. It's made up of an anesthesiologist, such as myself, who is a physician, and then an advanced practice professional, such as a certified registered nurse anesthetist, a CRNA, or an anesthesiologist assistant, such as an AA. Usually the CRNA or the AA will be with you the entire time in the operating room, and the anesthesiologist usually supervises 2 to 4 operating rooms and will be with you during induction and emergence and in and out throughout the procedure. The next common question that I get is, what type of anesthesia are you going to use? So for kidney surgery, you will have a general anesthetic. This is when we use a combination of medications to put you in a sleep-like state. It does require a breathing tube, which is to be placed after you're asleep and removed before you're awake. Most people don't really remember any part of this. Another type of anesthesia, which you've probably had before, but what we can't use for kidney surgery, is monitored anesthesia care. And that's usually known as a twilight. It's typically used for colonoscopies, and that's when we use propofol. And in this type of anesthetic, you're breathing by yourself. You're just under some deep sedation. And then finally, the last type of anesthesia that we want to discuss today is regional anesthesia, which is usually used as an adjunct to either general anesthesia or monitored anesthesia care. What this technique does is it uses local anesthetics, very similar to lidocaine, to numb a portion of the body. Examples of regional anesthesia include epidurals, nerve blocks, and fascial plane blocks. So let's go a little bit more into regional anesthesia. If for your kidney surgery, if you're having what's known as an open approach, so not a laparoscopic or robotic technique, you will most likely be offered regional anesthesia in addition to your general anesthesia. The goal of this is to anesthetize targeted areas of the body to decrease postoperative pain, and we do that with that numbing agent such as lidocaine. The 2 options that are most common in kidney surgery are an epidural, which is exactly what you're thinking, what laboring women get in childbirth, but we usually place it a little bit higher up in the spine to really numb up the abdominal portion of the body. With the epidural, there's a catheter that's left the size of a fishing wire, very, very thin. It'll deliver a continuous infusion of medication throughout the procedure, and it's usually left in for the next few days. If we don't perform an epidural, the other common technique is something called a fascial plane block, which are just single shot injections in your abdomen to numb up the abdomen. These procedures are usually done with sedation before we induce general anesthesia. Most patients don't remember any part of that. And why do we use regional anesthesia? We use it because by avoiding narcotics, which is the aim of this, we decrease pain, we minimize opiate side effects, and we decrease length of stay. So if you are offered a regional anesthetic technique, I would highly recommend it for your kidney surgery. So let's go into preparing for surgery. What happens from an anesthesia perspective once you are booked in your surgical clinic for surgery? Well, at this point, someone will contact you and ask you to come in to the pre-anesthesia testing clinic. And what are we going to do there? Well, we really go over your past medical history and we perform a risk assessment. Are you ready for surgery? Is there anything that we can do to make things better for surgery? So we will do an in-depth history. And if you do have a significant past medical history, such as heart disease, diabetes, or COPD, we might ask for additional records. What can I do for the best outcome? So as a patient, what can you do? And I think this is one of the most important slides because it might be empowering to know that you also can do something to change the course of your hospitalization and to really have the best possible outcomes. And that's something called preoperative optimization. Let's be in the best place that we can when we go in for surgery. So what can you do? Number one, nutrition. Eat low salt, low fat, low sugar foods before surgery. Proper nutrition has really been shown to improve outcomes after surgery. And if you are interested more in that, you can probably ask your surgeon for a nutritional consult, and that would be very helpful. Number two, if you have diabetes, it's very important to control your blood sugar. If it's not controlled, then please contact your endocrinologist or your primary care doctor, whoever's prescribing your diabetes medications, to make sure that your diabetes is well controlled. Then stop smoking. Even if it's the day before surgery, the morning of surgery, as early as you can before surgery, stop smoking. That will have a huge benefit in outcomes if you can stop smoking. And then finally, stay active. And this doesn't mean, you don't have to join a gym or buy weights or do anything fancy. Just getting up and walking for 30 minutes a day will really help for you to get back to your baseline as soon as possible. All of these techniques are really what we call evidence-based techniques. They've been shown and proven time and time again to decrease length of stay, perioperative complications, nausea and vomiting, and help improve and decrease really the time to return to baseline function. So what does that mean? That means the time it takes to get you back to where you were when you entered the hospital. And we want to do that as soon as possible. So let's start with the day of surgery. What's going to happen the day of surgery? You're going to come in the morning into the preoperative holding area. And from an anesthesia standpoint, you're going to meet your team. That will be your anesthesiologist and your CRNA or AA. You'll review your medical history, and a lot of this you've probably already shared with people time and time again, but you'll review it once more and go over the plan for anesthesia. Again, like I mentioned before, if you are offered a regional anesthetic technique, I would highly recommend it. And then, of course, discuss any questions or concerns. The plan that we come up with is a dynamic plan based on input from you, your surgeon, and my team. And so together, the three of us will come up with a plan that we are all comfortable with. So once you're in the pre-op area, we're going to roll back to the operating room. And for the first 45 minutes to an hour, we'll prepare you for surgery. So that means inducing general anesthesia. We'll place a breathing tube, any additional IVs to monitor, and an arterial line to monitor blood pressure. And then we'll get you positioned and prepped for surgery. So a lot of times for kidney surgery, you'll be positioned laterally, so either on your left side or your right side. What's very important here is that you let us know if you have any limitations before surgery. If you can't move your arm or hip or your shoulder is injured, it's very important to let us know before we position you under anesthesia. After that, your surgeon will come in and get started on the surgery. That'll be the next 2 to 3 hours. We will stay with you the entire time, monitor your vital signs, your breathing, your urine output, and we're constantly in communication with your surgeon. So as a team, we can make sure that you're safe and that we get you through surgery safely. Once your surgeon is done, we'll go ahead and emerge you from anesthesia. This might take about 30 minutes, in which we have you wake up, remove the breathing tube. You will be awake, but you may not remember this part. Many of my patients will ask, when will I be awake after surgery? And the answer is almost immediately, but you may not remember it. You may be groggy for the rest of the day. And then finally, you'll go to the recovery room right after surgery. And there you're expected to stay probably about an hour. And there the nurse there will monitor your pain, make sure your pain's under control. Any nausea or vomiting, which is one of the most common side effects of anesthesia. Make sure you're awake enough, and then also monitor your vital signs. And as long as those 4 things are under control, then you'll probably be sent to your room.